Thank you. So I will give you a bit of information about Emma, Emma Health. I will not go into detail about everything, but to start Emma Health, our goal is to keep you healthy. So it's based, or Emma is based on preventive healthcare. So it's not like, for example, oncology, which has a mean to cure people. The goal is to keep people healthy and to give them action points how they can stay as long as possible in the best possible health. Now, Emma Health is founded by Dr Servaas Benjé. He is a team doctor of Lotto Soudal. It's a Belgian cycling team. He's also a general practitioner and a sports physician. And a totally other profile is Jelle. Jelle van der Velde is a serial entrepreneur, a new business developer, and his startup was acquired by Carta Mundi, and he also gives a lot of entrepreneurial advice. He has a great knowledge about IT, algorithms, AI, and so on. So how did everything start? So Servaas worked as a GP, and he was kind of the frustrated kind of GP because he wanted, he knew the importance of preventive healthcare, and he knew it from the athlete cyclists that it's very important to keep people healthy. But in his practice, he didn't have time for that. He only had 15 minutes per patient, and he had to make the people better, but he could not work on lifestyle or on other things. Then he met Jelle. Jelle went to Servaas because he wanted to run the 20 miles of Antwerp, and he wanted to know, am I in the best condition to run the 20 miles, or is there something wrong with me? And that's how they started talking, and that is actually how Emma was born. So if we look at this, at the age, we said this morning, at the age around 25, we're in our best health. It's by means of reproduction and so on. So 25 is our top health. From that point on, everything declines. But, sorry. So from that point on, and we have our symptom. Do you have something to, is this a pointer? No, it's not working. Okay, so we have the symptom limits, and from that point on, we get really sick. We get headaches. We get all kinds of symptoms related to a disease. But it's possible to remain. Oh, thank you. Yeah. So at this point, that's too late. For Emma Health, we cannot do anything about the people anymore. This is our window of opportunity for Emma, because we are focusing on lifestyle-related diseases. So we're not focusing on, for example, do you carry the breast cancer gene, yes or no? No, we are focusing on the lifestyle-mediated diseases, and our goal is to keep people as long as possible in this optimal health. So we can we have a lot of means to keep the health as good as possible. So that is what Emma stands for. It's not just a nice name of a lady or something, but Emma stands for empower people through medical autonomy. So what we want to do, Emma is data-driven, preventive and personalized healthcare. So we want to gather data from the people, personalized data, and give them personalized action points on how to remain in the best health as possible. How do we do that? We always compare this to your car. If you look at the dashboard of your car, or if you look at your phone now, you can see how is your car doing. Does your car need maintenance? Is there still enough fuel in? How are the tires? Your car, we know more about our car than we know about our body. So that was what Jelle said. I want to know how my body is. I want to look at something and know, okay, which are my action points? Because if your car, if there's a light flashing in red, you go immediately to the garage and you let it fix. If there's something orange, you know, oh, okay, I have to pay attention to this. I will go tomorrow or next week. The same should be with our body. So he said, okay, we will make a dashboard for each person, so it's totally individual, and it's a dashboard on your health. So we look at the medical conditions, the lifestyle-related diseases, and we also try to give people something about their lifestyle. So I will go into depth in a minute. So we gather this information and we want to visualize this in a very easy way, because there are a lot of things people can know information about their health, but it's mostly not very visual, or people don't understand it, or it's too in detail and they don't know what to do with it. So with this dashboard, it's very simple. When people get a green color, it's okay. You're okay, for example, on cardiovascular diseases. When it's orange, it says, okay, you have to pay attention to it. And when it's red, it's okay. That's a big problem for you. You have to take immediate action. So what do we focus on? We focus on the medical intake, the medical risks that are lifestyle mediated, and we focus on the lifestyle. This is our first version, which was released in April this year. The second version will be released in March 2020. For example, the first version is only is not a mobile version, it's only an online platform. It was not possible to get everything in a mobile version when we launched, because there were too many errors still in it. Also, the UX design was not ready for the mobile version. So this is the online version. And we start with the medical intake. So we use the same medical intakes and decision algorithms as a general practitioner would use. So it's the same questions. For example, this is on, I think it's on diabetes. So we focus on the big 5+1. That means we focus now on cardiovascular diseases, we focus on diabetes, we focus on cancers, and we have the lung cancer, breast cancer, cervical cancer and colorectal cancer. We focus on lung diseases, and then we also focus on overall health and mental well-being and depression. So we use these algorithms and we use the intake. And what is the advantage when we compare this to a GP? We can do a lot more in less time. Your general practitioner would need 30 minutes to 1 hour for this whole intake. Emma can do this in a much shorter time. Also, Emma is not biased. She doesn't get tired. She doesn't make human errors, also on. And a GP can only make an assessment of one person at a time. Emma can do 1,000 at a time. So that's the advantage. When people fill in the questionnaire, I think the questionnaire takes about 10 to 20 minutes. When people fill in the questionnaire, they get an immediate result. So they don't have to wait for like 5 minutes or 5 days or 20 days. They get an immediate result. And it's, this is, for example, this is Jelle, his profile. That's why the logo of cervical cancer is not in it, because Jelle is a guy. So we know, okay, he has to pay attention to his cardiovascular diseases. And it's also linked with the advice, the lifestyle advice. What should he do concerning his lifestyle to have a better cardiovascular health? But also, what medical steps should he take? Does he has to go see a doctor? Does he has to go take a screening test or something? So it's a very personalized action plan that we get when filling in this questionnaire. So this is the first part. What happens after this part after the medical intake? All the data goes through to the electronic patient file of the GP. So you cannot work with Emma if you don't have a GP. So that's very important. So people have to fill in their general practitioner when starting on the platform. If not, they're gonna go any further. Why is that? Because it's very important that all the medical information on that person is in that file. So the GP gets an email with, okay, Jelle just participated on the screening platform of emmahealth, and we see that he's in good condition concerning breast cancer, he's in good condition concerning cardiovascular diseases, but he should pay attention to lung diseases and so on. Also, before pushing the data into the electronic patient file, all the data is always double checked by our doctors. So they don't see the personal data, they just see, okay, this person has answered this on specific questions. This means that he has a higher risk or a medium risk or a low risk. And then everything is pushed through to the electronic patient file. So all the GPs in Flanders was also had a notification from that, and they know that people can join emmahealth and that the data is in their medical files. After this, after the medical risk intake, we also have the lifestyle intake. So on the lifestyle part, we focus on food, nutrition, exercise, resilience, coping, mental health, sleep, and substance abuse. So these are also questionnaires people have to fill in, and then we make the match. Then we look. Now, first they get also their dashboard. So, for example, concerning sleep, you don't sleep enough. Oh, watch out, if you don't sleep enough, it can increase your risk on, and then you can see on which possible health risks the person has. So, that's the lifestyle part. The lifestyle part is not pushed through into the electronic patient file. That's only for the medical risk and the medical data. So after that, the patient gets his dashboard. So how is my health at this moment? That's very important. So we can look at, so this is Jelle. We know his medical risk file, so he has to pay attention to colorectal cancer. His overall health is not so good. His weight, is his weight a bit? No, it's okay. Cardiovascular diseases. And then we see the lifestyle part. We look on food, mental health, sleep, movement, and substance abuse. Also, there is room for my care team, so who's your GP, who's your dietitian, they can fill in that part as well. We have a specific action plan. Yeah, my action plan is here. So that is what do you have to do now. So the people also can ask their reports to know, okay, what is my detailed action plan? What should I do? For example, should I go see a doctor? Should I go to a gynecologist, my GP? Should I start exercising or stop exercising? Do I have to pay attention to my nutrition and so on? So they get their action plan. So this is only the first version of emmahealth, and we noticed that, for example, reusage was not so easy because, okay, people know this is my health at my moment, at this moment, but they had no reason to fill everything in again. So that is why we're working on the second version of emmahealth, and in this version we will include objective data. So not only the subjective data from the questionnaires we have, but also the objective data from, for example, the DNA, biomarkers, microbiome, and bloods. We will do this by self-testing at home, so people do not have to go and see their GP. And all the data is again filled in. They have to wait a bit longer on the results. So the results of the medical intake, the questionnaires, they will get immediately, and then additional, they will get the results on the genomics, on microbiome, and so on. So in that way, we can give them a more personalized advice on their lifestyle. What we also will do is there will be a mobile version of Emma, because now it's only the online screening platform, so the mobile version will also be there. And we're exploring the use of wearables, because a lot of people have wearables, and we're looking at how can we sync this with the platform, how can people fill in everything, and look, okay, if you keep on living this way, everything will, it will be better concerning your diabetes or pre-diabetes or your chronic vascular diseases and so on. So this is what we're doing now, and we're expecting to see this in April or March. And then, okay, we had the takeoff of emmahealth in April this year. And we had an events partner for that was Partena. It's like an insurance fund. And it was regulatory approved that all the people who were with Partena, so with the sickness funds, can use emmahealth for free for an entire year. For us, that's very important to gather the data, because the more users we have, the more data we have, the more the algorithm can grow, can get preciser, and we can give more personalized data to the people. So a lot of people filled in or use emmahealth, and we are also now contacting some of these people just to know, okay, how was your experience? How can we make things better, and so on. So this is what we had. The reimbursement will be from January this year. They had to use it. They could use it for free until the end of this year, and then from January on, it will be for free for all the people within Partena. And as said, so the success of Emma is indeed in the volume. So it's very, very important that emmahealth one is known and that people start using emmahealth. So we were all over the media, magazines and so on. Also Belgian and the Belgian football teams. There was around the field you could see emmahealth, because also we're based in a football stadium with emmahealth, so that's also very handy. But we really need that. We already have a lot of users, but just to make the system a little bit better, we still need more users. Definitely when the other biomarkers will come into the algorithms, the volume is extremely necessary. Our emmahealth team is a very diverse team. I, together with Sander, is working on the medical risk intakes and the lifestyle intakes and the algorithms from that on. But then we have our software engineers, we have our design engineers. So it's a very diverse team who have to work very close together. But what is also very important, some of the algorithms we use, or some of the medical intakes we use, are medically validated, but only for face-to-face use. For example, not use on an online platform or for self-assessment. And that's also why we have our advisory board. They have their expertise in different areas, and we come together a few times a year to discuss specific projects on emmahealth. Voila, that was the short presentation on Emma. So we are still looking, if you want to join us, just join. We can, gather our strengths and, see what is possible. So thank you.